Welcome to our March 18th, 2020 Emergency Board of County Commissions meeting. Just for the public, it seems by our agenda that public comments will be at the end of the presentation today. So with that, we're going to have our invocation by Pastor Darrell Orman, followed by the Pledge of Allegiance. Please stand.
Thank you, Mr. Commissioner. The last time I met with y'all to pray, if you'll remember, we asked the Lord Jesus to protect the Treasure Coast in relationship to this virus. And I'm giving glory to him that as of today, if you look at the map, the only 4 counties in Florida that don't have a reported case are Martin County, St. Lucie County, Indian River County, and Okeechobee County. And what are the odds of that? We want to give God the glory. Amen? Father, we just want to tell you we love you and thank you for this commission that you've given us. We thank you, Lord, that you've appointed them to look out for us and to help protect us. And we pray, dear God, that you would just pour your Spirit out upon us today. We thank you, Lord, for your grace and mercy. We recognize your mighty hand. We know, Lord, that it's not happenstance, it's not luck, it's your divine providence that is protecting us. And we just want to tell you we love you today and praise you and thank you. In Jesus' precious name, amen.
Okay, and with that, we're going to move right into our coronavirus update.
The agenda?
Mr. Chair, I'd make a motion to approve the agenda for today's meeting.
I'll second it.
Motion by Commissioner Campy, seconded by Commissioner Hetherington. All in favor?
Aye.
Motion passes unanimously.
Mr. Chair, before we go to the presentation, I know that there's been some comments. I received some, I'm not sure if my commission colleagues did as well, that why were we having this meeting when we were supposed to be meeting? And I just wanted to let the public know that we're meeting today in the Blake Library in the Armstrong Room so that the commissioners can be a safe distance apart from each other, and that the members of the audience that are here, the seats are spaced several feet apart. I think the important part of the meeting was that we're going to be giving information and instruction to the public, so it wasn't meant as some cavalier decision that we would be meeting, but I think it's still important that the residents get a lot of their information from us at these meetings, so that's why we were having today's meeting, and I just want, why would we still do this? Thank you, sir.
So we have the health department with us today. Where's Carol? And Renee, they have a presentation. We've been meeting on a regular basis, as some of you have been calling in. All of our commissioners have, and so it's important, I think, for Carol Ann and the health department to, if you all would like to move down, for the ones that have that in your face, I apologize, but we're trying to make the best.
I'm Carol Ann Vitani. I'm the health officer of the Florida Department of Health. And I want to thank you today for allowing me to, speak with all of you. So first, just to give you a little overview of the presentation, we'll discuss the situation, the current situation update, the transmission and symptoms of the COVID-19 virus, the treatment and testing for the virus, the prevention initiatives, some of the travel advisories, and some of the public health monitoring that's happening. So, as many of you know, on March 1st, the Florida Department of Health reported Florida's first 2 cases of COVID-19 in Hillsborough and Manatee County residents. As a result, the governor issued an executive order, 2051, directing a public health emergency and establishing Florida's response protocol for COVID-19. The state Surgeon General issued a declaration of public health emergency for the state of Florida. Let's talk a little bit about the outbreak of new coronavirus, which was detected in late 2019. It was first discovered in Wuhan, China province, and it was a respiratory illness. It was first detected within an animal market, and we quickly learned that it began to spread person to person. What we've also learned is that it is now spread to many other countries, including the United States, and the World Health Organization listed it now as a global pandemic. As of March 17th, 5:11 p.m., we've had 216 cases in Florida. And at this time, there are no cases of COVID-19 in Martin County. COVID-19 most often spreads from person to person. It spreads through respiratory droplet from one infected person when they sneeze or cough. So it is these respiratory droplets, when you sneeze, come out and then they drop. And that's why we're suggesting, and the recommendation is, that you stand within, it can spread within 6 feet. So that's why we are recommending the distancing. Some of the symptoms. They can appear 2 to 14 days after exposure. Fever, cough, difficulty breathing have been the 3 main symptoms of the virus. Symptoms can be mild to severe. Fortunately, if it is fortunate, this virus, most patients, 80%, have usually mild to moderate symptoms. And of course, our most vulnerable, which is our elderly population and our immunocompromised, we're seeing the most severe cases in. Testing and treatment, and I know all of you have heard a lot about that. And it's still changing and evolving. But currently, the CDC recommends people who think they may have been exposed to COVID-19 to call their healthcare provider and self-isolate. Testing currently by the Department of Health is limited due to our collection and specimen kits. We're anticipating arrival of these kits any day. Martin Health Cleveland Clinic is performing drive-through testing by appointment only after screening patients to ensure they meet the screening criteria. There is no specific treatment for COVID-19. Patients receive supportive care, and currently there is no vaccine for the virus. Testing criteria, and we are anticipating that that will expand as well. So currently, the testing criteria is persons who've had close contact with a confirmed case, persons hospitalized with acute respiratory illness of unknown origin, a history of travel to or from affected areas with widespread community transmission, history of international travel or a cruise, those 65 years and older with chronic health conditions, immunocompromised persons, and testing is also available per the recommendation of the physician. Prevention. Prevention is the best medicine. Everyone has a responsibility to prevent the spread of this virus. What do we do to prevent ourselves? Well, as you've heard, we wash our hands with soap and water as often as possible for at least a minimum of 20 seconds. We use hand sanitizer with at least 60% alcohol. We avoid touching our eyes, nose, mouth, and avoid close contact with sick people. And most importantly, we stay home when we're sick. The other initiative also as part of this prevention effort is to clean and disinfect surfaces that we frequently touch, which are your door handles, your desktops, your phones, cell phones. And cover your cough and sneeze. Practice social distancing. So that's what we're doing today. The public health recommendations are suggesting that they cancellation of gatherings greater than 10 people and limit interaction if you are 65 or older and have a chronic health condition such as compromised immunity, diabetes, and heart or lung disease in multiple gatherings. CDC travel advisories. As you know, these are changing also. Countries with sustained community or widespread transmission. We want to avoid those at all costs. China, Iran, most European countries, United Kingdom, Ireland, and South Korea. And for more information, of course, go to the www.cdc.gov website. What is self-isolation? So you may have heard a lot about, oh, people are self-isolating. So for people who may have been exposed but have no symptoms, monitor for symptoms for 14 days. So you want to isolate for 14 days, and if you end up having symptoms, then you want to notify your physician. So you self-isolate for 14 days, stay home as much as possible, avoid travel on publicly used vehicles, gatherings with groups of people, and going out in the public. Work remotely if possible. And of course, follow recommendations for prevention of. Those with suspected or confirmed COVID-19 are asked to take precautions, immediately isolate at home or at your healthcare facility, and that would be at the directive of your physician. Do not participate in public activities such as work, only travel by ambulance or private car, and avoid public transmission. Always wear a mask when around other people. Cough and sneezes, and clean your hands. Visit our websites to learn more. If you go to the DOH www.flhealth.gov, they have, as soon as you get to the site, you click on the COVID-19 response. And as well, now the state has set up a database so that you would be able to see on a ongoing basis the cases in each county. Of course, website, always the CDC, for accurate information, and that's www.cdc.gov. Call centers. So the state has a 24/7 call center to answer any of the COVID-19 questions and concerns that, and that number is 1-866-779-6121. And we locally at the Department of Health in Martin County have also set up a call center. So anyone could call there from 8 to 5, Monday through Friday, and that number is 772-4000. Press option 9. Questions?
How many tests have you performed?
We've done a limited number of tests. I would say approximately 8. That bulk of the testing is being done.
Ms. Vitani, thank you very much for the presentation. I know that that was more of an overview, like from the statewide perspective. Can you tell us what you're finding with your staff here in Martin County? I know that Commissioner Hurd's question is an important one, that you haven't done a lot of testing in your specific facility because you're not supposed to be doing that testing. It's handled at the hospital level. But what locally are the recommendations? What are you hearing from people that are calling your office? I know you have the hotline number, and I'm sure it's been ringing off the hook. What are you hearing, and what can you give us in terms of the flavor of what's happening here locally?
So what's happening locally, what we're hearing is a lot of our citizens are calling, asking questions about the testing. Of course, our nurses are also screening them according to the criteria. Recommending if they're ill, of course, to call their provider, also to stay home. Referring them to, of course, the websites. Yeah,
Well,
go ahead.
We just want to close the screen down for a second.
You and I had an opportunity to speak yesterday, and I know that your department's also doing a lot of work with assisted living facilities and nursing homes, which we obviously in Martin County have a lot of. Can you give us an update on
Yes.
that?
So I will tell you that, our epidemiology division, it closely monitors our assisted living and nursing homes. We monitor for any indication of seeing any type of rise in flu-like symptoms, and as you know, there's similar. So if there's any kind of indication that we see a rise, then we are. In fact, we've been in contact with them right from the start, providing them additional.
Are private physicians practices doing testing? And then is there a constant flow of information? Groups of private physicians to your office?
Anytime we receive. They also have the specimen kits. So it's a two-part. Collect the specimen, and the diagnostic piece occurs. Or, because I know that request for specimen collections. So once that happens, then we'll be able to, more practices, more doctors' practices, agencies that are. Yes.
So you should call your private practice if they're able to do the test.
Yes, absolutely. Yes, to see if they're able to do the test, because not.
The question, is there anybody here from the Cleveland Clinic? Excellent. How can people receive tests at the Cleveland Clinic?
So I don't know if I have all the most up-to-date information. I'm really here more to receive information about community resources and what's available. Scott Samples, our PIO, has been handling most of that. But I do know that if people are interested in getting testing, we have drive-through testing at North Hospital. They have to do an appointment and they have to call. The phone number is 772-419-3360.
Would you repeat that, please?
Yes, it's 772-419-3360.
Thank you.
You're welcome.
Would you state your name for the record, please?
Yes, Angela Alicio.
Yeah.
No more? Yeah, okay.
If there's any other questions, be happy to answer, otherwise.
Perfect, thank you.
Okay, thank you.
So my comments are sort of more general in nature in terms of, I think, what can we be doing as local government to make sure economy are not shutting down. I don't know if, I assume for those of you who are following Facebook and watching other forms of social media, saw an interesting post yesterday, for those of you who know Kyle out at Kyle G's out on the island. He's opened up an open dialogue with all the restaurants. It was an amazing type of dialogue in terms of how should the restaurant be, how should the restaurant community be dealing with this and acting like this? Because all noticed yesterday, downtown Stewart was almost like a ghost town at lunch. And so they're all trying to anecdotally understand how to deal with that, how to prepare with their staff. What are the requirements from the state mean to them with their half seating capacities that they have? Yesterday we learned that the bars that were just bars and less than 50% of their business was food would be required to shut down at 5 p.m. And so I would encourage all of us to think about how we deal with our local businesses. I think here at the county, I would encourage us, Taryn, and maybe this is part of the conversation today, maybe it's next week during the commission meeting. I understand the city of Stewart is basically canceling all of its meetings for the next 2 months. I hope we do not, and if we have to meet in this forum here, all the better. Because we do put a fair amount of money back into the economy with the business that we do as the county. And I think that to the extent that we can make sure that our permits are being issued, that our development orders are being dealt with, anything that will keep people out there working, to the extent that we need to, I think, keep our money flowing from the county out into the community, the better. Going to be every single ounce of support and help that we can put out there is going to help people. I had even a thought the other day that maybe we should even explore, like on our building permit costs, is that something we want to think about doing something differently? Fire people, if they weren't going to do something, if they were holding off for any given reason, what could we do to inspire them to do that project, the air conditioning swap out, whatever it may be, and that we are helping them make a decision to make sure filtering back out into the economy through fees, through their contracts, their purchases from local vendors, and so on. So I don't know if internally, I know I didn't have a chance yesterday to meet with Sarah back and forth, and this just kind of popped into my head last night that be sitting down and exploring everything. What can we do that will inspire others to more?
That's good. He can stop. We just didn't want the light. It kept shining in
Yeah,
Commissioner
no,
Heatherington's
I'm
eyes.
just thinking about the noise, that's all.
We're just putting the screen up for those that are not
Great.
able to see us. Yes, Commissioner, we are doing that as your leadership team. I know you saw us meeting the other day and popped in to see what we're doing. We do have reserves set aside, particularly for the building department and our utilities department. We have operating reserves for 3 to 6 months. So those are the things that we know we're going to have to keep doing. So we are doing that, yes.
Yeah, I think everybody should be throwing some ideas out and thinking, we really thought this clear. Sarah just said to me this morning, which I thought was a great idea for restaurants. I don't feel that you should be going to a restaurant if, even with the separation of the tables that they're doing and the reduction of the amount of tables available, gift card, and give that to someone for a restaurant, that'll keep some cash flow moving. I thought that was a great suggestion. Was your daughter that? Better away from you if it was your idea, but just
Elizabeth Wood.
and so anything like that, I think that we should be doing, certainly explore, and certainly, I for one believe that we should continue to keep meeting, keep our business open, and that we, to the extent that we can perform our duties as we normally do, we should.
Several different things I'd like to discuss, but I just wanted to let you know. City of Stewart, I've just been told, is their meetings are canceled until April 9th. Take it from there on that point. So I agree with Commissioner Smith that a lot of the local municipalities are figuring out what to do with governmental meetings. Currently, at this moment, the City of Stewart has canceled meetings up until April 9th, and then they will reevaluate at that point. And that just goes to show you how constantly things are evolving. I have several different things to discuss with you, and I'm happy very much that we're having this meeting because the traditional duration of the commission meetings for regular day-to-day commission and governmental business is now changed. I think each of us, I'll only speak for myself, but I'm assuming everyone in the room is going through the same thing. You sort of rationalize and come to terms with what you think the current situation is, and then it changes again. I mean, for those of us that have either, K through 12 students or even college students, I'll give a personal example. My children were on spring break. I have twins that are freshmen in college. And then they said, well, possibly they don't want them to come back for a couple of days after spring break. And then it was, we don't want them to come back until March 28th. And then we've heard that a lot of colleges have switched where they don't want, especially the underclassmen or, non-seniors, to come back for the remainder of the semester. And then that there's a lot of discussion and talk about online and virtual school, but there's a lot to online and virtual school. A lot of folks, whether they're in college or primary education, don't have the luxury of laptops and constant internet access. So when we speak about the opportunity for virtual schooling, that sounds like a terrific option, but it's not a terrific option for many, many families that don't have that as an ability. Or if I guess it's obviously better than having nothing, because I think the other issues that are going to crop up in regards to the school-aged student population is their emotional and mental health. They're going through something. If grown-ups are struggling to rationalize what's happening in something that has never happened before, and I'm one who lived through September 11th, I was in New York City at the time. So although this has sort of that, like, things are going to be different from now on kind of feels similar to 9/11, the scope is so much broader because 9/11 happened along the East Coast. And if you were in the middle of the country or in the, the West Coast or the Southwest, although as an American you were affected by it, but it wasn't a personal day-to-day change in your lifestyle necessarily until you started traveling. This is affecting everyone. So I think if parents are concerned, they have to really understand, look for resources so that they can answer the questions to their children at home. And when I say children, I mean that could be at any age. There are young adults that are in their 20s and 30s that are also concerned. My family members were concerned that I was coming to this meeting today. I will tell you, if you hear it in my voice, I have a little bit of a rasp and I've been sneezing, but let's also not forget that coronavirus did not knock out hay fever and allergies and pollen. If this was a month and a half ago, we would say, oh, people are suffering allergies. So we want to be cautious not to make every cough and sniffle cause for concern. I did actually triage at the demands of my family to find out if I was appropriate to have the swabbing, which thankfully I was not. I do not meet those criteria. So if you have a family member or a coworker or a friend or loved one that's got the sniffles, don't automatically assume that they have the coronavirus. I think the other thing in regards to the kids and students being at home, there was, social media has been very interesting. It can be a blessing and a curse. I mean, you can get a lot of information and reassurance and from different websites and people are passing along information, but also remember some of the things that are passed along that look very legitimate are not legitimate information. I don't know if people do it on purpose to see if they, this whole concept of spreading misinformation, but at least take what you see online with a grain of salt. But that being said, the power and the positivity of social media, there are a lot of sites that are reassuring people. I know that there's this website or an app called Nextdoor, and I know in Palm City there were a couple of older residents that were concerned about having supplies, didn't have the ability to travel, didn't have the ability to get even the basics. The gold commodity these days is toilet paper. And just in the last couple of days of following the threads of responses and comments to that woman, there were so many people that said, I have extra. I can go to the grocery store for you. I will leave the groceries outside your house. That's about as grassroots at the community level that exists. So I'm very happy that we have that as an option. The other thing I would tell people is, even it's mostly handled with politics, websites that look legitimate like actual news outlets, because they have names that sound like news outlets, but they're really not. They have an ulterior motive and a very specific mission. I've seen some of those popping up on social media and getting passed along. And then when I did my own very basic research to find out, is what I'm reading true? I found out that they weren't actual sites. It was run by a single person who had a single opinion like any of the rest of us. So I would caution and urge residents that are using social media, which now is what we should be using, to really look at the sources. I would like to compliment our print and TV media. Some of the outlets, or at least one of them, is here. In times of crisis like this, a lot of us, especially older folks, go directly back to the news media. And I think that that's where we're finding our most legitimate options. I think this meeting is important because what we need to do is we need to inform and instruct. And I think as elected officials, we want to give out the information like the health department just did, but we also need to instruct. So I would speak to the families. Someone gave me an excellent suggestion that if your kids are starting to get nervous, and they did this again after 9/11, remind them that there are heroes in our communities. There are heroes that are health workers that work in hospitals and handle our sick people, work in nursing homes, first responders. So when they're feeling nervous that everything is terrible, remind them that in all amongst us are everyday heroes. And then if they really want to, they can send either write cards or letters or posters of support. I don't know.
Sorry.
Oh, it's okay. I don't know if how you would handle those things in terms of if they are carrying germs on them. Maybe you spray them with Lysol, but I think the reassurance, and to Commissioner Smith's point, as long as the restaurants and food establishments are open, until we hear advice from higher up the ladder that, in order to flatten the curve, which seems to be the new expression, also will require them to completely close, similar to what the governor had done, I guess, with bars and nightclub establishments. There are ways to support local restaurants that don't require you entering the facility. And if I know a lot of them have pivoted to an approach of takeout or delivery, and when I say delivery, a lot of folks have never tried the delivery dudes and Grubhub and all these other things. Even if your local restaurant doesn't have like the typical delivery man or woman that we think of, there are food establishments that are most now are signed up. As a former small business owner, this is going to be a health emergency, and it's going to have a ripple effect for a long time. None of us know how long. It'll have a tremendous economic ripple effect as well. But while restaurants are still open, and you have the ability to support them through purchasing of gift cards that you can give out after the fact, or ordering food to take out and tip the delivery as though you were sitting in the restaurant, I think is helpful. I did have an opportunity, Mr. Chair, to speak to Kate Kottner, who is our senior external affairs advisor for Florida Power and Light, because I don't know about the rest of you, but I had received a couple of calls, panicked, of people that were fearful that if they couldn't make an electric payment, what would happen to their service. And when I spoke to Ms. Kottner, she reassured me that obviously FPL has many policies in place that can handle people that have financial difficulties. And I said to her, well, understand that if that's the case, now multiply it by 1,000. Are they still in a position to do that? And she said, obviously they were. She sent me an email this morning that had just a couple of bullet points that are very important, I believe, that obviously FPL has a strong track record of preparing for these kind of emergencies. They've never prepared for this specific emergency, but they do drill and prepare for unknown emergencies. They are also prepared. I've heard some things on social media that said eventually electrical plant employees won't be allowed to, God bless you. She did not sneeze into the general air. she covered. Good for you. That there's no potential of a disruption of electrical service. They have everything in place. They can secure their facilities and still run them. So the concept that maybe in a week or so we're going to head to a blackout is not accurate. They have a pandemic plan in place to ensure continuity of service. They also have temporarily suspended all non-emergency in-home and in-business visits. So there's a big portion of their business that sends people out into the community to do those things. Now, if you're having an issue, an emergency issue at your home, something's wrong, you still can call FPL and find out and they'll have technicians or their personnel come out to see you. So it's not like you can't call for anything. But if you've had efficiency evaluations and all the other services that they normally offer, all of those are temporarily canceled, suspended. For customers experiencing hardship as a result of the COVID-19, they have resources available online at www.fpl.com/help, H-E-L-P. They are working with all of their customers regarding any issues they may have regarding their bill. And then she also said, and the last point that I'll mention about FPL is, for now, we are also suspending disconnections at least through the end of March. And like we were discussing earlier, how you've seen deadlines and dates evolve and push out, I would assume that would also mean past March. But the concept that some of our residents will be left in the dark for a lack of the ability to pay their bill, I don't think that will be the case. I apologize for taking this time, but this is what I believe this meeting was about. So I wanted to share some additional information if I could. I think as a suggestion, and I only briefly showed it to Ms. Krista, I want to remind the public that until otherwise we hear from the governor, that we're still in the sunshine. And what the sunshine law means is that our commissioners we are not allowed to speak to each other outside of a public meeting. So when someone asks me what's happening in Hobe Sound, or is Commissioner Hetherington or Commissioner Hurd, what is their opinion? And I say that I don't know. It's not because we're not collaborating. It's because we're not allowed to collaborate. So the more I thought about it in the last day or two, I was thinking that each of us, the 5 commissioners, we all serve on different boards as representatives of the local government, from the BDB to the Tourism Council to the Children's Services Council. And we also bring different set of experiences and expertise to the commission as your representatives. And so just as a suggestion, I'd like to put it out to my colleagues who, again, I'm not allowed to, it's not that I'm trying to put them on the spot. It's just that I'm not allowed to speak to them outside of this meeting. So they're hearing this for the first time, and it is purely a suggestion. I think that when I speak to representatives of the health department or of the hospital or from our staff, one of the frustrations in general is that member of our team would have to speak to each of the commissioners and tell the story 5 different times, if not more. That's just the 5 of us. Then they have to explain it to legal and explain it to administration. What I'd like to see happen is similar to how we are appointed to boards and committees and how we have taken lead on certain topics in the past. What I would recommend is that each of us take on a specific piece of the overall roles and responsibilities. And purely as a starting point, I would start with Chairman Jenkins. He is our representative on the BDB, which in my mind handles the economic development and economic health now, not so much development, but stability of our community. That would also involve the Economic Council, the Chambers of Commerce, businesses, both small and large, that are concerned and nervous. Some of them will sadly go out of business. Business, especially small entrepreneurs, the economy is fragile, and people's business models are fragile. And so when you have something like they're going to close bars for 30 days, that will put some people out of business. They won't be able to weather a 30-day closure. and what we talked about for restaurants where you can ask for takeout or do drive-through. I'm pretty sure law enforcement frowns on alcoholic drive-through. So with that in mind, I would recommend that Commissioner Jenkins, as well as his responsibility as chair, take on the economic development portion, just to be our point person, not to make decisions on behalf of the rest of us, to be our point person, so that if Ms. Krista or someone in the community wanted to reach out, they know that they can start with Commissioner Jenkins. And then he would bring that information back to us, just the way he would if he was going to a BDB meeting. So that would also include small and large businesses. And then as the chair, I think it's also important, and I see members of the community here from Sewell's Point and our other municipalities, that he remain the local intergovernment affairs point person. So if it's Jupiter Island or Indiantown or Sewell's Point or the city of Stewart, they know that they can speak to Commissioner Jenkins as the first point of contact. For Commissioner Hurd, she represents us on the Children's Services Council. I know you were at the meeting yesterday. And by virtue of that fact, she's involved with, funding a lot of our not-for-profits that involve the younger portion of our community and our population. With that, the United Way, the Community Foundation, the not-for-profits, the Boys and Girls Club, and all things that are involving funding and grants. Now, you have to remember, when you hear that the federal government is contemplating an $850 billion stimulus package, that's going to be a long time before that money will trickle down through Tallahassee to our community. I have had, and I guess my colleagues have also had, requests from people that say, well, is the county going to postpone utility payments and mortgage payments and other fees like that? We have no ability to do that whatsoever. We do have some basic grant and not-for-profit funding authority that we accomplish about once a year, but we don't have a budget to handle a situation that we're in. So that would be what I would like to see as a suggestion that Commissioner Hurd would be, which is already some of her responsibilities for the board. For Commissioner Smith, we have an excellent resource that a lot of other communities don't have. Commissioner Smith, just like Commissioner Hurd, has been at this for decades, and by that virtue has created relationships throughout the state of Florida, especially in Tallahassee, and throughout Washington, D.C. He is the former president of the Florida Association of Counties, which gives him a tremendous amount of credibility with our colleagues in the state. But he's also now currently on the NACO, which is the National Association of Counties Board, and that's the federal board. He's very familiar with the Treasure Coast Regional Planning Council and has strong relationships and lobbying, even political elected officials lobby back and forth to get what we need in Tallahassee and in D.C. I would also put him with all of our state representatives. His other wheelhouse, in my opinion, is tourism. He has served as chair and been on the board of the Tourist Development Council for a long, long time, and this will obviously, when our economy is derived in large part by tourism. I already spoke to a woman that manages one of our local hotels, and this was probably a week or two ago. She was already saying that the reservations and accommodations have dropped off to near zero. So sadly similar to when we have environmental green tides and cyanobacteria issues, how we focus our attention on tourism. I'd like to see Commissioner Smith be our lead on handling hotels and tourism issues. You heard just this morning in his comments that he already has a real focus on this. Commissioner Hetherington, it used to be me, and now it's you, who was the commissioner that had school-age children. I don't. Mine are in college now. But Commissioner Hetherington has 2 school-aged sons. So I think the other thing I get a lot of questions on, and I'm assuming we all do, is questions regarding the school district that have nothing to do with us on the commission. But folks that know us as public figures, know us as elected officials, don't necessarily differentiate between the government and the school district. So what I would hope and recommend for Commissioner Hetherington is that she be our liaison between school district issues, which now also include private schools, charter schools, Catholic schools, homeschooling, whatever the schooling is, all of those organizations, even the you can get to the point of nursery schools and other little tutorial schools similar to like All About Achieving learning centers. They all need to be on the same page. They all need to be sharing the same message so that it's not confusing. I would also say that, and I mentioned it earlier in my comments, this whole concept of virtual school, there's a lot of strings attached to virtual schooling. There's a lot of supplies and resources that will have to be distributed out to families that are not able to have them on their own. To run out and purchase a laptop, even an inexpensive laptop, is hundreds and hundreds of dollars, and some families can't do that. I know Ms. Krista had been in conversation with members of the school district in terms of potentially leaving our libraries open to create Wi-Fi hotspots because some folks don't have them. I mean, as close as west of the Turnpike in Palm City Farms, there are some people that don't have reliable internet service. I know that Jeff Leslie and the Indiantown companies are working on that, but it's not going to be done in the next couple of weeks. So with that in mind, I would also like to see Commissioner Hetherington collaborate with our Parks and Recs Department, which includes beaches, and then also maybe to work on other youth issues, i.e. tykes and teens and mental health. What are we going to do during this time that the kids are out of school, which now, many of you have already heard, has been extended till April 15th. And as we get closer to the end of the school year, I would not be surprised. I'm not saying that it'll happen, but I wouldn't be surprised if that's extended even again. So what are we talking about? Emotional health, maybe with our tykes and teens and mental health service providers. And then finally, me. I feel that my benefit to the board as a collection would be my relationship with the health department. And the reason I feel that I have that, not that my colleagues don't, is that if you remember, sadly, the hepatitis A outbreak, a majority of those cases happened in my district, and in Palm City specifically. Not all, but a majority. So I had the opportunity to work very closely with the members of the health department. So I would like to be the collaboration or the connection, the point of contact with our health department, also with Cleveland Clinic and Martin Health Systems. I have a very strong friendship and relationship with Rob Lord and a lot of other folks. We all do. And I'm not saying that I have relationships at the hospital that Commissioner Hurd or others don't, but if we're divvying up these responsibilities, I'd like to be involved in that. The other portion that I'm interested in, and I used to serve on the Treasure Coast Food Bank Board, is what I'm calling food and supply distribution. I think other than our personal safety and our health, food and how are we going to feed the members of our community that are struggling. All of us have had the opportunity to make a run on the supermarkets and the dollar stores and Target and Walmart and the rest of it. But people that are struggling financially don't have the ability to run over and grab the last of everything on the shelves. They overwhelm our not-for-profits and our food pantries. And I think that, and I've worked very closely with Rob Ranieri at House of Hope as sort of the tip of the spear, but there's Lahia and there's churches that are doing food, meals on weekends, and there are also Elevate Hope that are distribution points for many people that are struggling. I'd like to see a collaboration there. And then, of course, FPL, even though I think we're not going to see a lot of controversy and issues with FPL. And then also, as you can just tell from my 15-minute or longer diatribe, that I would like to work with my colleagues and our staff on information delivery. No disrespect to our chair. I think he is a very capable communicator, but sometimes levels of emergency and things like that. And I'm not to say that no one else can say or speak or do, but if it was okay with him, I don't mind articulating the message on behalf of the county. And with that, sir, I thank my colleagues for their indulgence.
Very good. Commissioner Hurd, I saw your hand up.
Yeah. As you can see, this is a delicate balancing act between protecting livelihoods and paychecks and guarding health through reducing exposure, containing. So this is going, and that's the, I think the premier responsibility of government is to make sure that we're protecting public health. Are any Martin County departments closed?
Currently, no.
Okay, so all the parks are open,
Yes, ma'am.
okay?
We don't have the ability to close all of our parks. Not all of them are gated. So, in talking with the sheriff yesterday, he's put additional resources at our beaches. The student resource officers have been reassigned to the beaches so that they are able to assist him in separating large groups. And so, until we hear otherwise, right now, we're open.
Okay, excellent. I think that we still have a lot of discretion about, the governor has given local governments discretion to make stricter provisions if we want to, and we have not done that so far. Some communities have. They've restricted visits to assisted living facilities, to nursing homes, and that sort of thing. We haven't done that, but we have the ability to do that if we should find a cluster of infection, which we haven't. And I do serve on the Children's Services Council. We had an emergency meeting yesterday, and we fund 30-some programs countywide that provide services for children in our community. And some of those programs, because of federal guidelines and state guidelines, are not allowed to provide those programs any longer. They've stopped. They can't gather that many people in one place. So they're not able to provide those services. So, but there's still, these people they're very vulnerable people. Those staffs are, if they lose their jobs, those jobs become extremely difficult to replace. So the Children's Services Council made a preliminary emergency measure to continue paying salaries of all those programs that we fund until March 31st. We will have another meeting in 2 weeks to determine what changes, if any, because we want to make sure that we're not paying people to do nothing. If people can't do their jobs, and some people can't do their job, then we're going to try to pivot them into another job where they can provide services. So we're going to be making the same sort of difficult choices
Yeah.
in the upcoming weeks also.
And Commissioner, our libraries are closed to the general public, for instance, but we're still providing services for drive-through services. Our utilities departments are closed to the general public coming in, and we're asking people to utilize our online services. So those are the kinds of things we're doing, and we're reassigning staff. For instance, I see general services here where we've got our maintenance folks going around assisting us with additional cleaning efforts, and then we'll reach out. If we get to the point where we need to reassign some of the library staff, we'll do that, or the other departments. So each department head is managing that accordingly.
I just wanted to add, Commissioner, you mentioned nursing homes and assisted livings. Those are closed access under the governor's orders. So nobody can go into a nursing home or assisted living under the governor's declaration. If you want more specifics, I think our emergency management director can discuss it, but that's been done under the state rule.
Well, I know that there's a jurisdiction south of us that has gone farther than the governor's directive on restaurants closings.
chartered,
So,
Yes, ma'am. I just wanted to clarify as to nursing homes and assisted livings that they are covered.
I think it sounds to me like Martin County is acting wisely, prudently, cautiously. So residents can continue to have confidence that we will be doing everything to act in your best interests and keep.
Yes, ma'am.
Thanks.
Who was first? So ladies first. Commissioner Heather.
Thank you. On a positive note, I wanted to, as you all know, we had an election yesterday, and I served all day in the last week or so on the canvassing board, and I wanted to commend our supervisor of elections, because you heard in the news other counties had poll workers that didn't show up. We had an election that ran smoothly. All of our polls were open. They were open on time. They closed on time. Our election results came in smoothly. So I just wanted to commend our supervisor of elections, Vicki Davis, our staff, and all of the volunteers, because it was a constantly moving target to keep the polls open, and they had to be flexible. So they did a great job. And then prior to Commissioner Campy's comments, I actually thought, is there a representative from the school board or the school district in the building
No.
that might be able to give an update on their, or Michelle? I know it's constantly evolving, but as of yesterday, they were closing schools to April 15th and had some folks, do you want to give a little bit of an update?
Michelle may have, our EM director, she may
Michelle?
have an update. And also, Commissioner Heatherington, to your point about the voting, Vicki actually reached out to us, and we reassigned some of our personnel from the water park, which is closed, and sent them to the polls to assist her. So we were able to do that.
That's great.
So good morning, Michelle Jones, Emergency Management Director. We've been working really closely with the school district through the Emergency Operations Center, holding daily calls with them to get updates on their status and their potential needs. They have closed schools or gone to virtual school through April 15th and reevaluating, reassessing as needed on a 2-week basis. The Food and Nutrition Services Department are providing free meals to children from 9:30 to 12 from Monday, March 23rd to Friday, March 27th. And those meals will be served to children aged 18 and under at J.D. Parker, Port Salerno, and Warfield. And I know they're also working on a location in Hope Sound. Their playgrounds and outdoor athletic facilities are also closed to the public during this time.
That's probably the majority of constituent calls, and, you know, they're concerned about, you know, when are their children going to go back to school? How are they going to go back to school? How are the parents going to go back to work? So,
Graduation.
Alert Martin is certainly a place that our residents can go for information, and you could text Alert Martin to 888-777, and also go to our website and sign up to get continuous updates on Alert Martin. I think to further Commissioner Campy's point, it's great, you know, that everybody takes a lead, but somehow we have to make sure that we facilitate that communication is flowing back to all of us. And I wanted to thank our communication folks because they've been working day and night, and there's not that many of them. So yeah, I think we're probably going to have to consider, you know, how we help resource them in the future, because, you know, this is something that is not like a hurricane that has a more defined timeline, and it's certainly an open-ended timeline, and I don't know how the couple of them are going to be able to sustain, you know, this undefined time period. So I think as a board, we might consider how do we make sure that we are giving them the resources they need to sustain us, because even if each one of us take that lead, you know, we need to be able to funnel that information. So that's something I'd like to have us consider, to make sure that they have the resources to provide that information to the public. And that is all I had.
Commissioner Smith.
Thank you, Mr. Chair. Two other thoughts I had listening to all the various comments. One is a sort of an anecdotal story, maybe anecdotal is not the right. I was in Publix last night around 8:30, 9 o'clock. And what was interesting in our Jensen Publix, some of the shelves were starting to get some things back on the shelf that haven't been there for maybe the past week or so. And it struck me that I should, as I was passing Publix employees, to tell them thank you for what they've been doing, because they've been taking a brunt of a lot of this. And much to my disappointment, with my checkout person last night, I told her thank you, and I said, you guys are doing an amazing job. And she said, oh, you don't know the half of it. And I don't want to call her out too much, but she does have a little bit of an accent, which is kind of somewhat normal. And she said, I've had people that have told me to go back to the country from where I came from because this is disrespectful, and her communication maybe isn't as perfectly clear as it should be, but she told me last night she's been here for 28 years and worked for Publix for that long. And so again, I told her thank you, and she was most appreciative. And I guess what I would share with everybody is that patience is an enormous virtue at this point, and be kind to our people out there. They're trying to make our lives get back together into one piece because it's not easy. You know, it's interesting, when you go into a Publix, you pass by 6 or 7 employees in the course of your trip through Publix, and they're all people too, and they all have lives, and they're trying the hardest they can try to make sure that our expectations of what we go into Publix to find, and I'm just pulling out Publix because it's a place, but it's a very Publix place, and most of us understand it and know it. And so to the extent that if you are going to go to a restaurant, be grateful. I think Ed had a really good point. If somebody's delivering something to you and you feel like you can tip them more than you would normally tip somebody, please do. I think it's the acts of kindness that will occur over the next months to come will make a significant difference in a lot of people's lives. And so that's that on that. I just would encourage everybody to be as friendly as they can be. I guess one other piece of that, when I was at BJ's the other day, getting cat food, which seemed like a silly thing to be doing, but I needed cat food. There were probably 15 people in line, and each line at BJ's checking out, it was packed. I don't know that I've ever seen it quite that full. And people's tension level was like right up to here. And you could see it, you could feel it, you could sense it. And when I was getting into the car, the lady next to me, she said, "Well, that was pretty crazy, wasn't it?" I said, "Yeah, it sure was." But she said it with a smile, and she said it in the most happy way. And I said, "So patience is an important thing over the next months?" And she said, "Yeah, it really is." And she said, "Have a great day." And I said, "You too." So to the extent that we can behave like that, I think that would be incredibly important. And lastly, if it's okay, and I know we have some public comments, but I talked to Michelle from Sewell's Point. She shared with me some things or ideas that they're doing out on the peninsula. And if Michelle, if you or your commissioner could come up and just share with us what you're planning on doing. I just think it's a really good idea, and it's a great community-driven kind of thought. And I think things like this will help us start to heal, but it'll also start to help some of maybe our nonprofits in a great way. Thank you, Mr. Chair.
And state your name for the record.
Thank you. Mr. Chairman, okay with you? Is it okay with you, Mr. Chairman?
Yes.
Okay. I'm just going to wipe this for a second. I hope it doesn't. Thank you. Unexpected, did not fill out a card, so appreciate the flexibility. Commissioner Kurzman is here representing the entire board for us. We wanted to make sure that we showed our support for our Board of County Commissioners and appreciate the leadership that we're getting from Ms. Krista and team. The communications have been strong, and we tactically are ready to go as far as our plans are concerned to create that consistency as well. From a humanity standpoint, that's what I think I hear each one of you speaking about is how do we make sure that we take care of our people? And the work that you each have to do is so much larger than, what we have as a very small town. But I had posted on my Facebook this morning that whether it's a small town like ours or big international cities, we're all faced with this issue that we're dealing with humans who are up to and including panicked. And so the best that we can do to offer them insight as to the work that we're doing to protect them is important. So one of the things that my chief of police and I have been discussing is how do we make sure that we're taking care of our senior population? We do have some seniors that are homebound, and so we are coming up with plans on how to make sure that our commissioners reach out, and I can make sure that I can provide you with numbers should you need that as well. And we also want to participate from a community standpoint in a food drive and supply drive, to Commissioner Campy's point of making sure that we're offering our best supplies. So we have an outside portion of our town hall that we can start to collect and then start to work with distribution agencies to get that out there. So I'll keep it simple with that and just say that I would work through Taryn, if that's okay with you, to let her know what we are ready to offer. Outside of that, we lean on you for our support. So we appreciate your leadership and continued communication, so thank you very much.
Thank you.
Michelle, very much. Thank you, Mr. Chair.
So, Chair, I'm not sure, we've got a couple public comment speaker forms, but also Ms. Woods and I would like an opportunity to get some guidance from the board relative to our future meetings. And, just in your minds, if you can start thinking, there are some things that we don't have to bring back to the board. There's some presentations. I'm asking staff to provide those via email, and we will shoot those out to you rather than having to have staff necessarily come and present at a board meeting, so that we can limit our exposure. And if you're okay with this setup, we'll keep setting it up this way. But
That was my question, was how, in your mind, how are we going to continue doing the business of the board? This seems to be a proper venue at this time, less than 50 people. And
do you want to do public comment now, or do it after we have a chance to
it's up
do our
to you.
stuff?
If you want to discuss it now, then,
Okay.
yeah.
So I did print out the agenda. You already have a few items that we do on consent, and so I think that, we do have some of your things that are time sensitive. We have primarily, we've got Conky Joe's, and I think, if we can, like to Commissioner Smith's comments earlier, if we can keep bringing those things forward that are time sensitive, they've been in the pipeline for a period of time, and making sure that we keep them on a timeline. And then we have the referendum that Commissioner Hurd had asked for, but like the status of the flood insurance rate maps, I think we can pull that off. I know it was a request by the board, but we could probably get a presentation to you, like I said, via email, and then you can, get your questions back to staff that you want. You have your regular Office of Management and Budget items, and as I was thinking that through, we could streamline that from the perspective that, and I was looking at the one from this last meeting. You have, let me get my numbers. You have like 5 that are permission to assign the grants, and then you have 5 that are to apply, and 4 to accept those grants. That's been a lot of your activities on there, are these grant-related issues. Anything, obviously, that needs a resolution or an ordinance that would require board approval, we could do that. But if you wanted to delegate those back to us, between Ms. Woods and myself, or I can get with the chair and go over them, and if the chair's comfortable with them, then that could be delegated to get those approved and keep those going. Those are projects that we have. The other item.
Well, let's pause there and get
Yep.
the opinion of the board at that point. What is, go ahead.
For the sake, if we were going to get together and continue to have our meetings, are those items take no time at all to go through unless somebody wants to pull one?
No, I appreciate that.
Streamlining is great, but I also don't have an issue if we spend a half an hour or 20 minutes going through and getting that done. I would encourage doing
Yes,
it.
sir.
My sense of this whole thing is, to the extent that we don't have to disrupt our normal sort of process, if you will, until we're told otherwise that we can't continue to do our process, I think it's important to send that message that we are in business and we're conducting our business. Me personally, I wouldn't defer things. I would keep moving.
Well, the only reason for that, Commissioner Smith, is those items, everyone, you might have 8 to 10 departments, and you've seen them in the queue waiting to come up in case there's a question on them, because we don't, unfortunately, we don't have the capacity to.
So what I would recommend to our commission is that if you have a question with one of those, ask it ahead.
Great.
And if we only need 3 staff to show up, because
Yeah,
there's
I agree with
I
that.
would agree.
Okay,
there's
perfect.
no reason why we shouldn't be doing that anyway, but to the extent possible, if you all can review those and look at them and make sure that any questions that can get answered so that
Yeah.
it can be fairly streamlined, that would be great.
Okay, no, that's perfect.
That's
So
me.
it was just the Office of Management and Budget, and then the contracts will do the same thing. So if you, we try to do a good job of getting our agenda out before the Friday, before the meetings, but if you can get those questions, or at least let us know that you're going to have questions in which department you want, we'll make sure that we've got that queued up. Ms. Woods, is there anything else that you're thinking?
No, but Ms. Krista and I both discussed this under your ordinance and under the You have the ability to craft a resolution perhaps going forward so that you can streamline your meetings or streamline power. And my recommendation was we would draft a resolution that would. There is a mechanism as we progress through this,
If we need.
if you need it.
If we need to
Yes,
apply it, yeah.
yes.
As long as y'all are going to keep meeting, or as long as the commissioners are okay with meeting, and as long as we can at least have our quorum, we're happy to continue to do this. Like I said, this room, we didn't have this meeting yesterday primarily because this room was being used for the polls. It was a polling site, and so that's why we're doing it today, but we'll continue to have this arrangement and limit our presentations primarily, I think, at this time.
Yes, sir.
I agree with Commissioner Smith. The only point being that that's the traditional day-to-day operations of the government. I think our meetings have been relatively brief in the past anyway, so it's not like we have to shave down these long meetings. Things that are time-sensitive, like I see even something as appropriate as a notice of a plaque and recognition of appreciation for someone who's retiring, I still think that that's important to do. Things that are not necessarily time-sensitive can potentially be spread out. The only point being that if we meet twice a month, back to the coronavirus, we might have to continue to meet in an emergency session based on things that are happening with the governor.
Absolutely.
The reason I say that is that I think a lot of citizens get a lot of detailed, broader spectrum information of what's happening in their community from these meetings. Appreciate so much our televised coverage and our print media, but we're only getting a little bit of coverage because they got to cover everything. I think this is the only way that, this and the Stewart News and some other smaller media outlets, this is the only way they hear what's happening in their community. So I think that's important.
Mm-hmm.
So I wouldn't want to just meet every 2 weeks. I think that we have to have the flexibility, or at least my colleagues will agree or disagree, that when appropriate, we need to have a quick meeting. Can you give us the parameters on what has to happen for us to call an emergency meeting?
You have to provide reasonable notice, and Ms. Woods and I have, that can be, if it's a 24 hours, and that's the best we can do. We throw everything on our website. We get it noticed as soon as possible. So, we were comfortable with a kind of a 3-day, if you will, but it can be overnight.
Okay. I also think that it's important that we have these meetings here. I know that in the past for hurricanes and things like that, we used to meet in the media, kind of that studio setup that we have at the EOC.
Mm-hmm.
But then we also are going to be crowded on top of each other unless we all wait in the hallway and come in one at a time.
Commissioner Smith has the intake on that.
Commissioner Smith.
No, I'm with interest watching the president's briefings and the governor's briefings, and they seem to be very close in their briefings.
Right.
So I think if we're following federal and state guidelines and policies, I just find it all interesting.
I think the rationale there, I've thought about that, and I've had conversations about that same exact thing. I think if there's 7 or 8 of them, and you got the Surgeon General and the Lieutenant Governor and the Governor and others, they probably already have had some kind of medical screening to understand. Not necessarily in the mix.
Screen you every time you come in, Ed.
I hear you. So I just thought so you and I are on the same page. I was thinking that we're probably better off having even press conference meetings here. We have recently updated all of our media technology in this room, so we're utilizing it now, even though I will say I have received some feedback that our online presence has been challenged. I'm also getting feedback that the Channel 20 has been going in and out a little bit and difficult to hear us.
Well, what we're experiencing is when you have a high number of individuals that are trying to access us, either via internet or on our TV channel, it's creating an overload. You're going to have the same problem. I know we're going to experience the same thing having our employees working from home. So we've been diligent in getting our IT. We've upgraded a couple things where we've needed to make sure that, and we have a limited number of laptops right now, but we have some employees that don't have internet too. So having access to a library or someplace if they have to, there's things that we know we have to do. So we're doing those plans internally now, but that's exactly why you have this interruption, because there's so many people trying to access us right now.
Well, which is a classic example of when people are desperate for information and they come to their sources. So I would at least make a recommendation or a motion if need be, but this is, Mary Kay, just a recommendation, that we allow or instruct staff to work with IT, that, this is, we don't know what the end of this situation is, and people are going to be relying on just what I said, Channel 20 and the internet, to hear from us. So if you need to work with whoever our service providers are to take whatever our capacity is to the next level, I think that
Yep.
that's
We're
more
doing
and more
that.
people are going to be tuning
Well,
in.
we ran into it at the Emergency Operations Center as well. Our phones for communication, we haven't upgraded those for years, and the people that were calling in were having a hard time, and it was breaking in and out. So we had to, go and so those are the kinds of things that we need to start updating. Even our system in here, it was great that we got this updated in time for something like this.
Right,
So
but
can we
if-
spend some money on that over there?
We were looking at it. That was one thing I kidded with Michelle. I said we can get state reimbursement for that possibly, so let's go ahead and do it. And that's another reason why we went ahead and declared a local state of emergency. I know we got some grief from social media on that. We started incurring costs for this weeks ago. And we need to keep that documented, as well as, by declaring that emergency, that helps us. That's one of the steps that's required in order for us to work with FEMA and get some reimbursement. So those are the things that we've been doing. So yes, we're working on it. If we can get it. Supplies are compromised.
And I shared with Michelle, it was not her fault, but we need to fix that. Because it was,
Yes.
for those of you who tried to be on the call, you could hear about a third of the people that were on the call, and we had a microphone stuck up against the conference call
Yes.
phone, and it just,
For today's meeting, I know you've been coming, but for those that are able to call in for our unified command meeting, we're going to be back at the Public Safety Complex in the big room for that very reason. So those are the kinds of things that we're working through ourselves.
Well, I mean, now, of course, we're in the midst of an emergency and a crisis situation, so we're sensing it. But for those of us, I did okay on the call. The Florida Association of Counties had a statewide call last night at 8 o'clock, and I know that there was some confusion when the call began, but the 3 or 4 people that were the actual speakers, statewide call. So I think it's important that we have the right people in place to move really quickly on this, try to get those phone systems in place, because if you're asking commissioners to make important decisions during an emergency call and you can't hear 100% of the information, it's hard to be in the.
I appreciate that.
And so the other thing I'd like to say in terms of our meetings is, if we're going to meet every 2 weeks for our general business, maybe we should schedule the opposite, potentially Tuesday, as a rotating meeting, update meeting of specifically coronavirus-related situations, and if there is no news, then we can cancel it, but that allow that it's already sort of pre-scheduled, that we're having, at least it's on people's calendars, because you don't need to want to participate in a meeting and then you're not able to. So maybe if we, as commissioners and staff, block out every other Tuesday as a potential update time. If there's nothing to update, then you cancel the meeting, but if there is, then we can meet.
Okay, for the sake of time, if we can do our public speakers now. so
Sure.
Yes.
Rob and Elizabeth can get back to what they do best. Mr. Ranieri.
No timing? Okay, well,
Yeah.
you
Morning,
said-
Commissioners. First of all, thanks for having this meeting. It's definitely an opportunity to get some good information that we can bring back to our constituents and our clients at House of Hope. So a couple of things. I want to thank Commissioner Smith for those thoughtful comments about just continuing to do business as you do it and the economic value of that for the community. There's also a mental health value of that. As much as we can do to keep people in a routine through this, in their whatever sense of normalcy we can help them to maintain, has tremendous value as well. So I just want to make that point. And the plan that Commissioner Campy laid out, I applaud you for that as well. I think that's definitely an opportunity just to help the public to understand sort of where they can get good information, because there's a lot of information out there, but it's not always good information. We're trying hard at House of Hope to be a clearinghouse for that as well to the people that we serve. So just knowing a little bit more about your areas of expertise is helpful to us as well. So a little bit about sort of the community and what we're seeing and where we're heading. What we're doing at House of Hope, we don't really have a lot of comps for this, obviously, to model, but we're using hurricanes as a point for us to model some of what happens to our services in the aftermath of a disaster, sort of what's normal versus, what happens after that incident. We've also gotten a lot of information from agencies like us that are in other parts of the country that are further along in the impact and the number of cases and things like that in their community. New Rochelle, if you've probably seen on the news, is my hometown, so I've had the chance to speak to a lot of people there and find out how government and nonprofits are working in concert, and it's valuable, and it's making a huge difference just in the safety and well-being of that community, just to use that one example. So I'm thankful you're talking about doing all this, and I want to make sure that you all know I'm a resource available for any questions or suggestions you may have in what we're doing. So back to the modeling, what we're doing at House of Hope, we're looking at it two ways: food and financial assistance. And we've taken sort of what we normally see over a couple of months for financial assistance requests, what happens in the aftermath of a storm, for example, for financial assistance requests, and then using really kind of the large surge in client interaction we've had with new clients over the last week or so, and especially over the last few days this week, we're kind of creating another tier. So, and I'm going to share that modeling with the county, with other nonprofits, the health department, everybody, because it's not information that's for me, it's information that's for us as a community to hopefully get our arms around this and do a lot of pre-planning and pre-preparation. And I'm sure Elizabeth will talk about that in her opportunity. So, we're anticipating that we could see from really April, starting in April is when we'll start to see a lot of financial requests ramp up, just because people will start to feel those effects now. The restaurant industry, really all the hospitality industries, a lot of hourly people that are being sent home early or furloughed, those people are going to feel it starting in April when they have to pay rent and pay utilities and pay other bills. So April, May, June, we would normally see, probably about 1,000 requests for financial assistance over those months. We're anticipating we'll probably see about 4,000 or more requests for financial support through those months. And the challenge with all this, in addition to the volume, is the timing. We're entering summer, which historically, all of those kinds of needs for food and financial support spike dramatically because of the seasonality of our economy. So factoring those variables into this, we're looking at a substantial issue, which could be as much as $800,000 or more needed just to keep people in their homes, keep people safe, keep people with their lights turned on, with their insurance paid, with their car running. So this is a substantial burden, and obviously I don't think any one agency, government, or nonprofit is equipped to handle in our community. We're only going to be successful if we're working very cohesively with each other. You talked a little bit about health, and I would just put into your thought process, food is health and housing is health. It isn't just about your physical well-being and what your doctor tells you. Mental health is also a big part of this. So we have agencies, besides House of Hope and, one thing that's nice is in the nonprofit world, I feel like we have a head start. We do a really good job already collaborating with each other and sharing resources with each other, working with your Health and Human Resources group, with the Veterans Administration. So we're already kind of doing that pretty well as a nonprofit, division in Martin County, amongst each other and with our government. And we're going to have to elevate that, and communication is going to be a big part of that. On the food side, last year we did about 1 million pounds of food, just under that, with our 4 food pantries, but also we currently provide about 15 external locations, soup kitchens, small church pantries, things like that, with food at no cost so that they can be successful. Where we spike again with that in the summer. So we're kind of forecasting out our food needs, and what's typically in these months that we're entering, 800 or 80,000 to 100,000 pounds. We're anticipating we'll probably be somewhere around 150 to 170,000 pounds per month of food over the next several months, assuming we can get it and keep it flowing and get it out to people. Distribution is another challenge. Agencies like House of Hope, Lahia, the Salvation Army, those, the frontline people around feeding our lower income community. We all also get about 80% of our volunteerism from seniors, which are the highest risk, or one of the highest risk categories for this. So they're staying away in droves, as they should. We need them to stay home and be healthy and be safe until we get past this. But what we're really ending up with now is, in the nonprofit world, around basic needs, food, clothing, shelter, financial assistance, medical support, and mental health support. We're all trying to do a lot more with a lot less, both financial resources and people resources. So anything you all can do as a group to encourage agencies you work with, groups you're a part of, to find a place to volunteer. We're all doing the social distancing thing. At House of Hope, for example, to access food, it's curbside pickup. We've limited who comes into our building dramatically. It's really our staff and our volunteers. We're pre-packaging food. We're bringing it out. We're dropping it into the trunks of their cars, and they're being able to drive away with it. Most every soup kitchen that's open, that's staying open right now in Martin County, has taken that same approach. They're boxing meals. You pull up, they hand it to you, you drive away. So we're trying to minimize those opportunities and do all the things we're hearing and being advised to do from the CDC and the health department around distancing, and around obviously proper and safe handling of our food products as well. So we're all doing that, but again, we're trying to do all of that with a lot less people. So even a small group of people to come to a place like House of Hope, for example, and box up food makes a difference, or go to a place like Lahia and maybe help them meal prep or package, box up all those meals. That's a piece to this that nobody ever had to do before, right? You just put out the buffet, they eat it, and they go home. Now they're having to package all of that. So we're all having to deal with needs where we need extra manpower, and we can use any support out there for that. Kids are home from school, and parents are comfortable with that to come in, again, in a safe, secure environment. Everybody's doing the same thing. We're making sure if someone looks like they're sick, they're going home. And I know every agency that we work with, we're all taking those same steps and following the same protocols. We're sanitizing the hell out of everything. Sorry I said that. Heck out of everything. We're doing all of those things to, minimize risk and still be able to be successful in administering the services that are critical for us to provide. I think Commissioner Campy touched on it. The challenge here is going to be the length of this. It's not like a hurricane where you have the week to prep, it hits, you got maybe a week aftermath, you get back to normal. This could be, 6 months. We're looking at it in 3-month increments at House of Hope. For the next 3 months, what do we need to deliver a high level of service? People, resources, money, food, understanding who's open out there in the network that we can properly and safely refer clients to address other needs around physical health, mental health, all of that. And then we're going to evaluate what we think is going to happen in the next 3 months. And unfortunately, this is going to be something that I think will be years before we have a full recovery to get back to where we were as a community. This is happening in key season, so everybody, for-profit and nonprofit, is losing out on a substantial chunk of the revenue that generally carries us through the summer. Whether you're for-profit or a nonprofit business, I think that's factual. We've canceled events. We're seeing a lot of our funders, because of what's happening on Wall Street, have to draw back a little bit at a time when we can really use a little bit of extra financial support. So these things are all real, and the business community is going to feel them the same effects. So that just magnifies sort of the number of people that are going to need assistance in some way, shape, or form. And just to give you kind of a view of what those numbers look like, on a regular day in Martin County, we've got about 17,000 people living at or below the poverty level. We have roughly about another 20,000 people that are in that food insecure situation where, statistically speaking, and this is a nationwide stat, about 40% of the country could not withstand one unexpected expense of $400 over the course of a month. So we have another 20,000 or so people that fall into that category. So you're looking at 37,000, roughly a quarter of our population, that before this crisis is financially insecure, basically, and food insecure. The numbers are going to magnify based on this, and the number of people that are already out of work or being furloughed and all of that. So, the impact on this is huge. It's not something we've ever experienced. What House of Hope and every agency that we work with in the nonprofit side has pledged to do is, as long as it's responsible and safe, we're going to man our posts and do what we do. We certainly need help to do that. Again, people, food, financial, we need help to do that. But that's our goal, that's our intent. We want to be there at a point when the community's probably going to need us at a level that we've never seen and experienced before. Just to give you an example, yesterday morning in one of our branches, we had a line of 15 new clients wanting to sign up. That's usually what we would see in that branch in a week. We had it in an hour. So, and we're at the beginning stages of this. So I don't want to sound like an alarmist, but it is alarming. And I think we have to prepare for it and be realistic. And if we overshoot and we over-prepare, good for us. But if we under-prepare, we make recovery that much harder. And, statistically speaking, one of the things that I think we do well at House of Hope is homeless prevention. And we're going to be tested on that like never before as a part of this process. But the reason that that's so important is it is so hard to get somebody out of homelessness. The resources, financial, medical, mental health that go into getting someone back, pulling someone back in from that are tremendous. If we can prevent it, there's value in that on every level for the family, for the community, for law enforcement. I mean, the impact's just, it's the ripple effect. It just goes out. So, these are all things I think we need to consider. Virtual school, I understand where we are, for health and all that, but there's pieces of that. Now you got 18,000 kids that would normally be in a structured, safe environment that are not in a structured and safe environment, right? So the reason that the Boys and Girls Clubs and places like that are so important to every community that they're in is because, statistically speaking, when kids have that downtime, they're 200% more likely to either commit a crime or be the victim of a crime. So that levels a whole nother piece into this. I think Ms. Krista mentioned about more patrols at the beach. If we're going to have all those kids at home, we need more patrols in the neighborhoods. I don't know how law enforcement's going to be able to do the things they need to do. So there's a lot of pieces to this. It would be great if there was some kind of an opportunity, with maybe a leadership piece from the commission, from law enforcement, some of the key nonprofits that are involved in this sector, some of the key mental and physical health agencies. If there was a way, it doesn't have to be face-to-face, whatever, a text group, an email group, some way to keep us all connected and constantly sharing information. And that part is important too, because this is shifting hourly. It's not even something daily, you know. I've been at other meetings where they're saying we'll reevaluate in 2 weeks or 3 weeks. You know, we're reevaluating at House of Hope 3 or 4 times a day based on new information and trends that we're getting and seeing in other parts of the country that are further along with this. So I know I kind of threw a lot out. The one other thing I'd like to say, you know, you were all talking about different tips and, you know, ways to sort of help each other. An important piece of this, when we talk about our senior population, so I'll use House of Hope as an example because I live that example. A lot of our seniors that come into House of Hope for food, they can come in every day to get fresh fruits and vegetables. And anyone can because we're really pushing that aspect. Our seniors, they come, they grab a couple of apples. They're not there for the apples. They're there because our staff and our volunteers are wonderful, compassionate, caring people, and it gets that senior out of the house and it gives them somewhere to go and somebody to talk to for 20 or 30 minutes. They go to the soup kitchens at night for the same reason. Maybe they need the meal, maybe they don't. They need the fellowship. So, you know, this time is going to be very challenging, I think, for our senior population on a lot of levels. If you got a friend, if you got a neighbor, if you got somebody that lives down the street that you know falls into that category and they live alone, obviously you can't go sit there and have tea with them, but pick up the telephone. Don't email them, don't text them. Pick up the phone, let them hear your voice, let them feel reassured, you know, from you, and spread that word amongst your constituents, your friends, your neighbors, and hear their voice. So if you can hear their anxiety or their fear in their voice and try to, you know, mitigate that. You know, the mental health aspect of this, I think, is something that we're not talking about enough right now. You know, the schools, you know, we need them to think about it going forward as well. So again, I know I threw out a lot, and I appreciate the opportunity to do that, and I'm happy to take any questions if you have them.
Any questions for Rob?
I do. You know, you're here, Rob, from House of Hope, but I know there are so many nonprofits like you. How are you all communicating together so that, you know, you're providing the unmet needs without duplicating them? So if the school district is providing meals and somebody's eligible for a school district meal, then they may not stretch, you know, have to stretch your resources at that time. How are you all sharing that information, and how could the county be helpful?
So the agencies that work around feeding, we naturally communicate because we already share resources. When I get, you know, a whole bunch of peppers, everybody gets a whole bunch of peppers, things like that. So the school district's piece, it's really continuity. You know, they're trying to keep in place what they historically do, and even in the summer, they do a really great job of that with their summer feeding program. So those meals are kind of already part of our food feeding network, if you will. So that's not an extra, it's really a continuance. So we haven't really thought about, do we have to give somebody less or more because maybe their kids are getting some of those meals, because they would have gotten them anyway. What we're trying to do is make sure that all of the agencies around town that are smaller and cover the broader geographic you know, segment of the community have what they need to function and be able to give people food who might be transportation challenged, and so they can only get to that little church pantry or whatever it might be. So, and that we do well all year long. We're heightening our communication, obviously, but we're following a lot of the same process and protocol. Like Lahia was at House of Hope yesterday getting supplies so they can continue, things like that. So we'll continue doing all of those things and following the same procedures around safety and food handling and availability.
Okay, thank you, Rob.
Rob, Michelle wants to say something, but in the meantime, you can wipe the microphone off of the next person. Yeah. Oh, you could, well, no, she needs the mic. Well, there's that. Oh, she's circumvented the whole thing. There you go.
That works, if
Yep.
that's okay.
Speak right into it, that mic.
Yeah.
Is this good? Yeah. Okay, perfect. So we've been working really closely in emergency management with House of Hope and a lot of our nonprofit partners. We've held a meeting, we're calling it Wraparound Services, to try to pull in all the different groups in the community that may have a hand in feeding and the boxed meals, financial assistance. We've worked with United Way to set up a disaster relief fund specific to our community that they would be able to help us get more funds into the assist those nonprofit agencies as well. We have a survey that we have for our nonprofit partners, meaning in case we haven't touched or reached out to them before, we're asking them to complete that to give us a little background and detail on the services that they might be able to provide, and then we can pull them into our wraparound services. We have a meeting this afternoon, virtually and at the EOC, to bring those folks together, and then our plan is to start meeting regularly with those groups, similar to how we're doing our public health and school district and public safety meeting every morning, pull together our wraparound services group so that we can just discuss with them what their needs may be, that there's no duplication of effort in the community. If there's a volunteer shortage, we can reach out to other partners that we may have to fill those gaps where we might see them so that we can continue to serve our community the best way that we can, and make sure that everyone has the most up-to-date information regarding this.
Okay. Elizabeth. If you could say your name for the record.
Elizabeth Barbella, President and CEO of the Community Foundation Martin St. Lucie. Thank you all for giving me the opportunity to speak. I'll keep my comments brief, but wanted to share a couple things with you. Community Foundation has been working in tandem across county lines in Martin and St. Lucie with local funders, as well as with emergency staff. On Friday, we jointly launched a survey of all of the not-for-profits, which I'm happy to share with your staff. In Martin County, that we did in partnership with United Way and Children's Services Council. In St. Lucie County, we also launched one on Monday. The initial survey is going to ask about opening, closing, hours of operation, anticipated impact on the organization, service delivery staff, and the recipients of service. And we expect to chase that, really challenging the organizations to quantify what they think that the impact is going to be. We'll share all of that information. In addition, we reached out to 211, which most of you are familiar with, and asked them if they could augment their system to create an online sign-in for local organizations that on a daily basis could go in and adjust their service delivery and what they will and won't be making available, because it's the easiest way for us to encourage the not-for-profit sector to be able to update their information. So that's the communications aspect. We'll be working in concert with the local funders to motivate local philanthropy so that we can really harness that and pair it with what public dollars will be available for the preparation, the interim, and the recovery phase. So there's a tremendous amount of dialogue that is going on in collaboration. I will tell you that amongst our not-for-profit community, these folks work in crisis every day in some way, shape, or form. So we're really trying to put a think tank together of people that can look at this unprecedented event and bring skills that they've used for things that they're very well versed in, like hurricanes, as others have said. The Community Foundation is looking to lead where it needs to, follow where it needs to, but be that conduit for critical information, but also to channel resources. So please know that we're a resource that's here for you, and I thank you for the opportunity to speak and share that.
Thank you very much. Mr. Saban apparently now you've ruined the microphone, but go ahead.
Morning. Jeff Saban, Waste Management. The purpose of me appearing before you today is very simple. We're in communication, constant communication with your staff relative to any labor shortages or disruptions of service, which we have experienced none. As Waste Management has contingency plans for all the above, working from home and remotely, and have enacted that. But so far, so good. We're not anticipating any issues, and we're handling the materials which have not been proven to be a conveyance of the spread of the COVID-19 either. So we're obviously protecting all of our employees in that way and taking those measures. As we move forward into the future, we may be modifying some of our communications. We are available online 24/7, WM.com. We have live chat. And we are going to be modifying probably some of our call center operations because of the closeness and of the working arrangement and environment. But I'll work closely with your staff if there's any changes in that regard as far as customer service goes. So with that, thank you very much. Appreciate it.
Thank you. Do we have any additional public comment? We don't. Do we have any additional commissioner comments?
Yes, I've been getting some updates. One is a question. The first is an update. I think several of us got it from the folks at AT&T. They wanted to let residents understand that they won't have service disruptions based on a lack of payment for your cell phone or your house phone, and that they've also increased the data limits that folks are having, especially now that there's going to be a lot of virtual school or individuals that are home. You know, kids in school, the only reason some people's data plans stay intact is because during the day the kids are not allowed to use their phones at school. And now they're home 24 hours a day, 7 days a week, just blowing up people's data plans. So AT&T is aware of that. The other question I had is for Michelle Jones. I know that we've talked a lot about the hospital and the health department, but I've received some information from a gentleman that owns a urgent care walk-in clinic, which for many people is their front line of medical assistance. Do you personally, or is there any, I haven't heard anything about urgent care or walk-in clinics. Can we create just something else to add to your list? The ability to understand, we're fortunate to have several in the county, but I don't know if there's any collaboration with them. And as we head potentially into restrictive travel, if that's something in the future, some people that don't have health insurance, we're talking about feeding people, some people go to urgent care and walk-in clinics. Can we create, if there is any, to share with them any protocols on what they should be doing, not be doing, what they should be looking out for? Maybe we can put those folks together as a group as well.
Absolutely, Commissioner. I believe Department of Health is coordinating or with those folks, and I'll
Yes.
reach out to them to see if they have a list.
Yeah, they told us the other day that they're coordinating, they're putting out those protocols based on what they're getting from their state level, from the Surgeon General.
Okay, so I'll follow up with them and see where they're at with that.
Perfect.
And reach out to them.
Is there any other commissioner comments? Yes, ma'am.
In closing, we too have made the decision to suspend disconnects for our water and sewer services for individuals that possibly are not able to make payment, and we will reassess that at the end of the month as well. We're just stressing over and over again to please use our online services or pick up the phone. We will be circling back around with our staff to make sure that we're being responsive when that happens. And we do have a hotline, which is 287-1652, and our website, www.martin.fl.us. We will direct you to other folks' website, and the reason for that is the information is changing so quickly that we don't want to have stale information. We want you to go right to the latest website. And if anybody has any questions, please feel free to reach out to us, and we will keep you posted.
Okay, and with that, our next meeting, from what I understand, will be right here next Tuesday at 9 a.m.
Yes, sir. We're going to leave the room the way it is, so.
Yeah, and with that, we are adjourned.